Nurse McCavitt, this is C.D. Robertson.
Right, thank you very much, Paisley. Hi, Mrs. Robertson. How are you doing today?
I'm doing well. How are you doing?
I'm doing good. So what brings you to my office today?
Well, I was prescribed a new medication. It's for my hypothyroidism.
Okay.
I'm a little unsure what the name is and how to use it.
Okay, well, do you know what it's called?
Starts with an S.
On your chart, you're taking Synthroid, is that correct?
Yeah.
Yes. It's also called levothyroxine sodium.
Okay.
It's a T4 synthetic drug, and it's a thyroid hormone.
Okay.
So do you know how this drug works?
No, not really. Will you inform me?
Yes, okay. So Synthroid increases your T3 and T4 levels.
Okay.
And it controls protein synthesis, increases your metabolic rate, glycogen use, cardiac output, renal blood flow, growth development at the cellular level, via action on the thyroid hormone receptors.
Okay.
Right.
So I know it treats my hypothyroidism. What else does it treat?
It's mainly known for treating hypothyroidism because it's a replacement therapy. It also treats myxedema and creatinism, thyroid toxicosis, congenital hypothyroidism, some types of thyroid cancer, and pituitary TSH suppression.
Okay. I'm unsure kind of what dosage I'm supposed to be taking. I think I'm taking 50 micrograms, but I'm unsure kind of, does that change or?
Initially you have a loading dose of 25 to 50 micrograms per day.
Okay.
And then you have a maintenance therapy of 50 to 200 micrograms per
okay.
day. It can also be taken IV, but that does not pertain to you.
Mm-hmm.
So do you know any administration instructions of how to take it?
I know I take it in the morning. Other than that, I really don't know.
That's mainly what you need to know.
Okay.
So you take it in the morning to decrease sleeplessness, and you give it at the same time each day to have maintenance level.
Okay. Are there any contraindications I need to be aware of?
Yes. So on your chart, it seems you have a pretty healthy background, but just to know, be aware if you have hypersensitivity, hypercalcemia, hypervitaminosis D, malabsorption syndrome, cardiovascular disease, renal calculi, renal failure, hypophosphatemia, dehydration, and excessive sunlight exposure.
Okay.
So make sure you're always drinking fluids and staying hydrated.
All right.
Do you have any side effects? Have you noticed anything while you're taking this
My
drug?
stomach kind of has been churning, kind of feeling a little uneasy sometimes. Is that one of the side effects?
It is a side effect.
Okay.
You can have anorexia, nausea, vomiting, diarrhea, cramps, drowsiness, headache, dizziness, vertigo, metallic taste, lethargic, or photophobia.
Okay.
Do you have any other of those side effects at all?
No, not really. Just the upset stomach a little bit.
Okay.
So I know I'm not on any drugs right now, any other medications I'm on, but if I do add a medication, is there any interactions with this drug?
Yes, the thyroid preparations increase the effect of oral anticoagulants because of drug displacement from the protein binding sites.
Okay.
So it's a high protein drug.
Okay.
And then when taking these thyroid replacement drugs with an adrenergic agent, such as a decongestant, the cardiac and central nervous system actions are increased. Levothyroxine can increase the effects of digitalis preparations, and insulin and oral antibiotic drug dosages may need to be increased.
Okay.
Also be aware if you are having adverse reaction signs, such as hypocalciuria, hypercalcemia, hyperphosphatemia, and hematuria.
Okay. Is there any other advice that you have for me?
Well, if you have hyperthyroidism effects, such as tachycardia, chest pain, palpitations, excessive sweating, nervousness, excitability, or irritability, that can be caused by a drug accumulation. So you should notify your provider if you have any of those, because that can be an overdose.
Okay, that's good to know.
Also, avoid foods that can inhibit thyroid secretion, such as strawberries, peaches and pears, cabbage, turnips, spinach, kale, Brussels sprouts, cauliflower, rashes, and peas.
Okay, just kind of eat those in little amounts?
Yes. Just
Okay.
be cautious
All right.
right now.
That makes sense.
Also know that this drug is not a cure for your hypothyroidism.
Okay.
It's just therapy because you have low T3 and T4 levels.
Okay.
And do you have any more questions today?
I don't think I do. I think you answered them all very well. Thank you very much.
Great. Thank you very much, and call if you have any more questions.
Thank you very much. Have a great day. Nursing implications for Synthroid. Record vital signs. Hypothyroidism, temperature, heart rate, and blood pressure usually decrease. With hyperthyroidism, tachycardia and palpitations may occur. Monitor patient's weight. Weight gain is commonly occurs in patients with hypothyroidism. Encourage patient to take drug at the same time. Teach patient to check warning signs on over-the-counter drug labels. Determine if the patient is taking anticoagulants or anti-diabetic agents. Direct patient to report signs of hyperthyroidism, such as tachycardia, chest pain, palpitations, excess sweating, nervousness, excitability, or irritability. Suggest that the patient carry a medic alert identification card, tag, or bracelet with condition and drug used. Caution patient to avoid foods that inhibit thyroid secretion. Teach the patient the side effects of Synthroid, and for the patient, for self-administration, have them take blood pressure and pulse before every dose, monitor their intake and output ratio, and weigh each day. Teach family that this product is not a cure, but controls symptoms, and that treatment is long-term.